Alright, here's your second video, and time ran out before I could mention the fact that a person who has TB is on antibiotics for 6 to 9 months. The reason for that, part of the reason, is that the bacteria just grows so incredibly slow. Right? Its replication time is 18 to 36 hours. Very slow, the generation time. With E. coli, the generation time is like 20 to 30 minutes. If it's really happy, it could just be 20 minutes. And so then if you have antibiotics in your system, it doesn't take long for the bacteria to start to replicate and the antibiotic to be effective. But because that replication time is so long, with TB, you're on the drugs for a very long time. Okay, so you have these tables in your packet. All right, not everything is there, but this is the pneumonia one, this is the bacteria of the upper respiratory system, and now we'll look at viruses. All right, here you have influenza. We've talked about this some. It is an upper respiratory tract disease initially, and then it can progress down to the lower respiratory tract. And signs and symptoms, you feel incredibly lousy, headache, chills, dry cough, body aches, fever, stuffy nose, sore throat. All right, the sore throat can be because of the virus getting into your cells and doing damage. It could be because of the increased nasal secretion that's running down the back of your throat that is irritating. And some of those symptoms are due to your immune response. All right, there's also extreme fatigue, and the extreme fatigue and fever are generally what can help disseminate or differentiate between influenza and just the common cold. All right, as far as death from influenza, all right, generally the death issue is going to be due to secondary infections. So the virus comes into you, it makes you sick, it does damage, and then even normal flora bacteria can then pose a risk. All right, the influenza virus itself, there are influenza A, B, and C viruses. They're all from the Orthomyxoviridae family, and so that is actually the causative agent for influenza. We're going to look at the Orthomyxoviridae, not just influenza A, B, or C. That's too easy. All right, we've heard this many times. There is the hemagglutinin protein, and then, or glycoprotein spike, and the neuraminidase, the H and the N. That is what is used to type what viruses are out there. Just in case you are interested in knowing more about the genetics of the virus, it is a single-stranded RNA virus, so it is also segmented. Right, there are just 10 genes that are on different RNA strands, so it looks like it's just all chopped up there, but it's actually supposed to be, designed to be, interestingly enough, individual strands, so it would be segmented. And it is known if that virus is the way it should be, packaged, assembled the way it should be, there will be 8 RNA strands. Actually pretty amazing how that can happen. Alright, that was a picture from a different textbook. This is the picture from your textbook showing the same material, the hemagglutinin, the neuraminidase, the capsid around the virus. And we've talked a lot about influenza in terms of antigenic drift and shift. Alright, so we're not going to talk about that anymore here. Alright, now we'll look at measles though. Alright, also known as rubeola. And here it shows the statistic of at least 450 children die every day from measles. Now, I looked it up after I posted these, and according to the CDC website in 2017, that number is at 300. Alright, so that 540 is probably about 5 years old, that statistic. Alright, and unfortunately that meant that prior to the vaccine there were a lot more deaths, but the vaccine is very effective. In the upper right-hand corner, you have a picture of someone laying on their stomach, and you can see the rash that will develop at the onset of the rash is thought to be when a person has the most amount of virus moving through their body. Now, since 2002, measles deaths have dropped by 74%, so you can see why those numbers could be quite high. And the reason for that is somewhat unclear, but it is known that about that time, the CDC really started to push the fact that there is a very effective vaccine. And so it was partially through better vaccination programs worldwide, as well as education. Now, measles is caused by the morbillivirus, also referred to as the rubeola virus. And interestingly, it should, in almost every case, infect the mouth. It is respiratory in nature, so it's going to start in the mouth, the upper respiratory tract, but you get these little white spots on the sides of the cheeks of the mouth, and those are referred to as Koplik spots, and that actually is diagnosis. So is measles an issue? All right, well, yes, if 300 kids each day worldwide are dying, that is a lot of human life lost. All right, the complications with measles. All right, you have the laryngitis. All right, relatively benign there. The virus enters the vocal cords, and you have inflammation. You lose your voice. Some people kind of think that laryngitis is kind of fun because your voice sounds odd, and I'm fine with that. But there can also be bronchopneumonia, right? More severe disease process is going on there. And then there can also be secondary bacterial infections, just like what can happen with influenza. It's viral, but you have damage to the area, cellular damage, and the bacteria then find a place to call home. All right, then pneumonia itself. And then the major issue, all right, really the major issue is this encephalitis that results in disorientation to coma and then even to death. And in 2019, right, this year there was an outbreak of measles in the Portland metropolitan area, Clark County of Washington. Soon after the first cases, there was basically a state of emergency put out in Clark County, which is very close to where I am right now, but it's okay. And then just 5 to 7 days later, the state of Washington issued a state of emergency for the number of cases of kids who develop measles. And this is a major issue due to lack of vaccination. In Clark County, where it started, it's estimated that there's a non-immunization rate of up to 80%, 75 to 80%. So 75 to 80% of the population of the kids are not getting their vaccines. So this is a major issue. All right, and what you heard on the news, I mean, all this top stuff, the laryngitis, the pneumonia, it could be just viral pneumonia, which generally your body just works through. But what you saw in the news was that there could be pretty healthy kids who got sick and then unfortunately died. And the encephalitis is not immediate. It can be a process that takes anywhere from a few weeks to a few months, even a couple of years after they have measles. And parents right now, there's a lot of parents who have to worry about whether or not their child is going to develop this encephalitis. All right, then there is, this is the major one. All right, encephalitis can be relatively minor. It is an issue with inflammation within the brain, but the sequelae, the long-term consequence, this is where death occurs. All right, the subacute sclerosing panencephalitis, progressive neurological degeneration of the cerebral cortex, the white matter, and the brain stem. And this is 1 in 1 million measles infections. All right, so that's not very many, but you don't want to be that one family who has to deal with this problem. All right, it involves a defective virus, so the virus mutates as it's moving from person to person. It can cause profound intellectual and neurological impairment. And once you get it, unfortunately, there isn't any cure. It will eventually lead to coma and then death. All right, then rubella. This is German measles, or also known as German measles. But it's rubella and not rubeola, so you got to keep those two straight. It is called rubella for what's referred to as little red, because it's not quite as complicated or severe as rubella is, or just regular measles that's caused by the rubevirus. And the rash is relatively minor, a few complications. Unfortunately, the major issue is in utero. All right, so there are differences based on whether the disease is postnatal or prenatal. That means if you are infected outside the womb or infected in the womb, because this virus can cross the placenta. So postnatal in a kid and an adult, it's relatively benign. You get the fever, it goes away. Sorry, the rash, it goes away, and it resolves in just a few days. With prenatal rubella, though, it is teratogenic, which means it causes harm to the fetus. The virus is transmitted from the mom to the fetus in utero. The mom can be asymptomatic, so the mom shouldn't even get the vaccine. The infection in the first trimester can result in miscarriage or multiple permanent defects, and then that effect can also be seen in the second trimester with those permanent defects. But the most common defects are going to be deafness. There can be cardiac abnormalities, ocular lesions that can lead to or result in blindness. And there also can be just the mental and physical retardation due to the stress and damage the virus does on the developing fetus. And again, it depends on how far into gestation the virus is introduced as to what the defect or the result might be. Can it be so severe that it causes death? Yes. All right, then we have chickenpox, signs and symptoms, fever. There's an incubation period of 10 to 20 days, which unfortunately means you can be in a lot of places during that time and not know that you are infected. All right, the rash is going to start to develop on the trunk usually, sometimes the scalp and the face, and moves out. The lesions are generally centripetal, more lesions in the center of the body than in the extremities, and it's going to last for 4 to 7 days. Patients are considered contagious until all the lesions have crusted over. However, small number of cases can develop into that encephalopathy.